Sometimes, as we are navigating the choppy waters of a difficult conversation, we may encounter obstacles that we had no way of seeing ahead of time. Icebergs, if you will. If we aren't attuned to the patient perspective, these icebergs could easily sink our ship. Traditionally, we view our efforts, the services we provide, as the key drivers of health and health outcomes. This is where we focus our clinical improvements and spend our resources. We strive to deliver top quality care. And there are still times when our patients have poor health outcomes, despite our best efforts. There are many drivers of health under the surface, and we are finding compelling research and experiences that encourage us to broaden our gaze and not just look at what we do and how we do it. Let's take a few minutes to think about the factors that can strongly impact our patients' health and our successful navigation of difficult conversations.
Healthcare organizations are all focused on improved health outcomes. So we're all asking, how do we get better health outcomes for the patients that we serve? We've learned that we have to look beyond the care that we provide to patients to get better health outcomes. We have to look at our patients both individually and as communities and explore what obstacles they're facing and how that impacts their health. When people have unmet social needs, it's a barrier to their health care. And we might offer them what we think is the best health care, and we still might not see improvements in their health outcomes. So it's important that healthcare organizations think about and address social determinants of health, because we're not going to have healthier patients until we do.
Social determinants of health are the social, environmental, and even historical and structural factors that can either help or hinder an individual's health and their health outcomes. So they include the conditions in which we are born, in which we grow, live, work, and age. So broadly, they include economic stability. So your access to education, including early childhood education, employment, what kind of income you have, whether you have medical debt, education. So what's your literacy level? Are you proficient in English? What did you have access to early childhood education that could help your outcomes later on in life as well? Another one is neighborhood and physical environment. So do you have good air quality in your neighborhood? Do you have green spaces and playgrounds and places where you can get exercise and feel safe when you're doing that? Is your house safe? You know, do you have lead-free paint? Are your pipes lead-free? Those are all going to affect your health outcomes. Another one is access to food. So do you have access to fresh food? Is it actually in your neighborhood? Can you get it easily? Or are you just hungry all the time? So that can also affect your health outcomes. Community and social context is another important one. Are you socially isolated? So in rural areas, and if you're elderly, do you have access to kind of social interaction and other people to kind of help you with just daily living? Racism, that is definitely a social determinant of health because of the stress that is associated with that. And then finally, just the healthcare system as a whole. So do you have access to insurance? Do you actually have quality health care? Do you have specialty care? Do you have a medical home, somewhere where you can go for your primary health care? So all of these kind of all together are aspects of social determinants of health.
A paper published in the New England Journal of Medicine shows us the impact of factors on premature death. 10% are related to healthcare delivery, 30% are related to genetics, 40% are related to the individual decisions people make, and 20% are related to the social and environmental factors, things we think of as social determinants of health. So if we add together the 40% of the individual decisions people make and the 20% on their social and environmental factors, we're really talking about 60% of a person's health. and 60% of the factors related to premature death. And so social determinants of health have a huge impact on a person's health. I think there are a lot of healthcare providers that do understand and see and hear the obstacles that their patients are facing. So like maybe Mrs. Jones comes in and she's got her 3 kids with her, and it's because there isn't any reliable childcare in the community, and the provider or the care team sees that and feels that during the encounter, right? Or maybe Mrs. Smith comes in, and when she's talking with the nurse and getting settled in the room, she shares that, you know, there's really not enough food because she's taking care of her grandkids, and there's not enough resources in her home to provide food for this bigger family. And so, you know, a lot of times care teams do hear about these things and see them and experience them with just anecdotal stories that patients share. But often, you know, we don't hear about them or we don't see them. So there are those unmet social needs that we don't know about because no one tells us about them, and we don't ask about them. And so then you're left wondering why a patient doesn't come back for that follow-up appointment, or why they never got their labs done, or why they're not adherent to their medication in the way that you would like them to be. And it's probably things that are happening that you don't know about. And if we take some time to ask, we'll be more informed and we can help our patients make better choices, or at least understand why our patients are making some of the choices they're making. I think it makes us more empathetic healthcare providers.